Hello, everyone. Welcome to a recording of a presentation for guidance for sports and recreation and fitness teams and clubs. This will be your information about COVID-19 protocols that you need to use as you're setting up your team or club this year. My name is Janet Dawson, and I'm a health promoter at Peterborough Public Health, and I'm pleased to introduce you to my colleague, Keith Beecroft, who's also a health promoter at Peterborough Public Health.
Thanks, Janet. Before we get going, we just want to respectfully acknowledge that the Peterborough Public Health is located on the Treaty 20 Mississauga territory and the traditional territory of the Mississauga and Chippewa Nations, collectively known as the Williams Treaties First Nations, which include Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Beausoleil, and Georgina Island First Nations. Peterborough Public Health respectfully acknowledges that the Williams Treaties First Nations are the stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We're all treaty people. And I think with that statement and thinking about the togetherness and allyship and team building, if you will, building is the wrong word, but it speaks to what we're here today to talk about team sports and coming together and really how we need to work together moving forward, both to protect the health and well-being of the people that are on these lands, as well as the lands themselves.
Perfect. Thanks so much, Keith. I just want to pause for a moment and just discuss the purpose and intent of this presentation. This is for the audience. The audience for this webinar is for any person who is organizing a sport, recreation, or fitness team or club or activity, anything to do with sport and recreation and organizing the actual event, so a practice or a game. This presentation contains information that is current as of March 25th. We know that the COVID landscape is always changing, so we do want to highlight this is current as of March 25th. The presentation is intended for education only and is not legal guidance. We do recommend that you search out your information from the regulations and seek legal guidance as appropriate. The owners and operators of the facilities, as well as any person who is responsible for organizing a sport, recreation, or fitness event, team, or club, must adapt their operations based on the orders currently in force under the Reopening of Ontario Act. So it is a combination between the facility as well as the organization, business, or organized group that is planning the events. There may be situations where the provincial rules and local public health rules vary in level of restriction. So when this happens, it's important that you take the most restrictive in terms of preventing the spread of COVID-19. So for this presentation, we will highlight a little bit of the science behind the transmission in sports and recreation. We will talk about the Ontario COVID-19 response framework and the regulations and rules underneath the response framework. We will talk about how facilities will be set up. And then most importantly, the bulk of the presentation will be discussing how you as an organizer of a team or club can prevent COVID-19 and how you can manage COVID-19 if there are cases. And we also have lots of resources available for you. So just quickly then, just to discuss about COVID-19 transmission, it is spread mainly from person to person through respiratory droplets, and that is when somebody is infected, when they're in their infectious period, which may not mean when they are symptomatic. Their infectious period could be a period of time before they are symptomatic. Respiratory droplets can travel up to 2 meters. So we have definitely got familiar with that measurement, 2 meters or 6 feet. And that can happen through their coughing, sneezing, or talking and yelling, which commonly happens in sports. And also transmitted when a person touches a surface or object that has the virus on it and then touches their nose, mouth, or eyes. Given the close contact nature of sports, this means that recreational activities and sports are considered high risk activities for COVID-19 transmission. We strongly encourage physical activity, but we do need to recognize that participants need to consider their own personal circumstances and risk factors about exposure risk to COVID-19 when making a decision about joining a sports and recreation program.
Thanks, Janet. So I thought I'd jump in a little bit here with some of the color-coded framework that really is guiding the response. 6, 7, and 8 we're going to talk to fairly quickly because the information contained is really relevant, I think, to understanding the level that we're in. But basically what Janet was mentioning at the very beginning of the presentation is that the rules change fairly regularly depending on the risk associated with the community, the prevalence of the COVID happening within the community, and so on and so forth. So the province has created this framework that addresses kind of real-time scenarios based on what is being experienced within that community. So like Janet said, today on March 25th, we're currently in the red or control zone, but as we'll talk about in a couple slides, those zones are subject to change based on current conditions. So when we're talking about sports and rec in 2 weeks or 5 weeks or 7 weeks, it's really upon you as the organizer to understand what zone we're in, what color zone we're in, and what those restrictions would be. And again, all of these resources will be linked at the end of the slideshow, but we'll go to the next slide, please, Janet. So each of those colored zones, the framework that's laid out on the website is really written in layman's terms. However, each of the colored zones is based in legislation or the Ontario regulations. And each one of those things that are required upon organizers of sports and rec will find the guidance and find the regulations that are actually requirements for them to operate safely and legally. With that said, the legalese in each of these regulations can be quite cumbersome. So public health is happy to help, navigate and translate and work through what those might mean for you. But primarily, we would refer you back to the framework for each of these regulations because there are different implications for each colored zone for each sport that you might want to be playing. Next slide, please. And to give you a little bit of an idea of how that works is that what the province is primarily looking at are a combination of different factors or metrics, if you will. The number of cases in the community, the ability of public health to respond to the number of cases in the community, the ability of the hospital to support the people that might become ill or severely ill with COVID in the community, and those types of factors. So it's not just the number of cases that the community is experiencing, but a whole host of factors. And typically what happens with that is that when a health unit is put into a color zone, they'll stay in that color zone for at least 2 weeks. It might go more restrictive sooner than that, but it certainly will not go less restrictive sooner than that. And typically what happens is that a designation will be announced on Friday and it will come into effect the following Monday. So what this means for sports and recreation primarily is that your plans are going to have to be flexible enough that you're able to offer programming to the participants in such a way that is both safe and compliant. And we would also recommend having that conversation with your participants and their parents and guardians upon registration to let them know that the plans are in place, but they are very, very evergreen plans and they might change on a moment's notice. So if you're considering running a 6 or 8 week program for a spring or summer event, the level of control might change. And what is allowed or not allowed to happen within that level will definitely dictate what activities you can and can't do. So we really want people to become familiar with that, and we're going to get into that a little bit more later on in this slideshow. But just to be aware that these controls are ever changing based on current scenarios, and that you just need to be aware of what can and can't happen within each red control zone or yellow control zone, etc. So with all of that said, one of the things that we've really talked about here is that the color levels are the same for all of the Peterborough City and County catchment area, but that doesn't necessarily mean that they're going to be the same in neighboring health unit zones. So if you are going to be looking at inter-health unit play, you're going to want to make sure that you're aware of what can and can't happen in those zones as well. In the instance that you do choose to have teams or games cohorted with another health unit, you're really going to want to be aware of what their health unit jurisdictions are, and in fact what the rules might be within those health unit jurisdictions. On Peterborough Public Health's website, we have our own section of orders that we've issued specific to Peterborough City and County. Other health units, there's 34 health units across the province, and each health unit has done the same to kind of help navigate this pandemic response. So you're going to want to really make sure that you're aware of the restrictions in the other areas that you might travel to specific to sports and recreation beyond what's listed in the framework.
Great. I just want to take a moment and pause and highlight that there is pretty extensive requirements for any sport and recreation facility for COVID-19. So when you're taking your club or your team to an indoor or outdoor space to practice or play games or run your event, that the facility will need to be modified to cover off the applicable public health measures. Some of the public health measures for a facility may actually fall to the team or club. For example, screening. The facility likely will not have active screening in place. That will need to be done by the team and club. So I just wanted to highlight that you will need to work collaboratively with any facility owner or operator that any facility that you attend, and the owner and operator, to make sure that between the team and club and the facility, all the required public health measures for the sport and recreation is covered off. And you'll want to make sure you're doing that to minimize the risk and liability for your organization. So getting to the nuts and bolts of our presentation for the benefit of your team or club. So you have to develop a plan before resuming activities. So even before you are doing registration, you'll want to develop your plan so that you can conduct registration with it in mind of how you're going to set up your teams. Now, the ministry does have a safety plan template and checklist on their website. And it is the requirement in the regulations that all businesses and organizations that are in operation have a safety plan. So that would include any sporting group, organization, organized group, or business. They need to have a safety plan. And you can use the ministry's safety plan template, or you can use one that is familiar to your organization. But at a minimum, you must make sure that you are covering off the relevant questions listed in the ministry template. So you can use your template, but just make sure you cover off the questions that the ministry has listed in their template. And so here are the questions that the ministry would ask in their template. They are a bit vague. The questions are a bit vague and may not necessarily cover off all the components that you would have to think through for a sport and recreation business. These questions cover all businesses and organizations that are open. So we have taken the liberty of pulling information, and we'll go over in the next few slides, the kinds of things that you will need to include in your safety plan for sport and recreation.
Great. So one of the big things, obviously, with public health as a whole, but specific to COVID-19, is we want to stop this before it happens. One of the things that happened within the last few weeks is that all of the screening tools now align themselves. And quite simply, what those screening tools dictate is that if you're not feeling well, you shouldn't participate in an event. And more so, you should more than likely go and get tested before you resume whatever that activity is. So for active screening, this is what we're saying has to happen for coaches, volunteers, participants, and anybody accompanying that piece. is really going through the process where they have to actively go through the questions, identify that they do not have any of the symptoms, they have not traveled outside of Canada, they've not been exposed to somebody that has had COVID or been diagnosed with COVID, and it's really that attestation and documentation that the screening has happened and the people that are showing up for the activity are safe and healthy to do so. This screening, if it's an after school or evening screen or program rather, should happen, ideally no more than 3 hours before that program starts, if not closer to the activity start time. Somebody that screens in positively or screens in that they're feeling well at the beginning of the day, that may not be true at the end of the day when the activity happens. So this screening really has to happen as close to the activity start time as possible. And there are a couple different tools there for the employee, who would be the coach and the volunteers facilitating the activity, and then a second tool for the participants or spectators who might be with those participants. The big piece with this one is that there has to be some sort of attestation and a record that everybody that's participating in the game, at the event, the activity is healthy and is free of those COVID symptoms that we've talked about. And those records need to be kept for at least 30 days. And primarily that's so that if there is, heaven forbid, a case associated with your team or your sport or your event, that public health can then take those records and do some contact tracing. And by that, we mean following up with kind of the domino effect of who was the person around and what kind of risk were they associated with and so on and so forth. But that attestation, first and foremost, suggests that the person is safe and healthy and ready to participate in the sport. And then two, that attestation will help us with contact tracing in the event that we need to follow up because of a case associated with your club or team. So the big piece here, and again, it's really trying to minimize the number of exposures that people might have with COVID-19. And we've said since the beginning that the virus doesn't move, we move the virus. And one of the things with this cohorting is that we're really trying to limit, one, the spread of the virus and moving it from place to place. But two, in the event that contact tracing does have to happen, we want to make sure that it's as tight and as manageable as possible, which is where that number 50 comes from. How that 50 is set up in terms of the leagues that you're able to play is up to you. I was involved with a house league hockey team this winter, and we had 4 teams of 10 or 11 participants. So we were well under that 50 participant total. And those 50 kids, or those in this instance, those 44 kids or so, played against each other all year. They were from the same community. And in the event that contact tracing had to happen, then those 50 would have been easily identified and we would have known what their circle was. It gets a lot more complicated, obviously, if that contact tracing and those teams of 50 span 2 or 3 different health unit zones for all of the reasons that are obvious. With that said, tournaments and playoffs involving teams that are not part of that 50 are not allowed. So how you set up your team, how you set up your season, how you set up your league, intra-squad play, intra-squad tournaments and championships and so on and so forth are not permitted at this time. You have to make sure that that team of 50 is maintained, that league of 50 is maintained rather, for the course of the season, and how that plays out for championship games and so on and so forth. We leave to you guys to decide and figure out how best it works. But bringing folks in from other leagues to play is not allowed per the regulations right now. One of the other things too we've talked a lot about is the creating of these leagues or cohorts with teams outside of the Peterborough Public Health region, and for lots of reasons, it's strongly discouraged. From a practical reason, though, we were aware of a case this past winter where a hockey team from the Peterborough area cohorted with another team from another health unit, which was fine. It was legal. They were maintaining their cohort or their league of 50. However, when the rules changed in the other health unit zone, that impacted not only the team in that health unit, but it also impacted the team in the Peterborough zone. And all of a sudden, they didn't have any other teams to play against because they were beholden to the rules from other health units. So for all of those reasons, we're suggesting that you keep your leagues and your teams and your activities specific to Peterborough Public Health area. It helps with contact tracing, it reduces the spread of COVID-19, and in the event that something happens outside of your team's control, at the very least, you'll still be able to maintain gameplay, provided that's allowed with the color zone that we're in. All of that to say, when you are going to these events and those types of things, 9 times out of 10 in non-COVID times, we would certainly recommend carpooling. However, in the event of the pandemic, obviously right now, participants should only travel with members of their immediate household to the facility, the event, or the activity. And while there's nothing perhaps suggesting that they can't play more than one team or sport, our recommendation is that athletes only play one team sport per season. Again, in the instance of a child playing basketball on Wednesday nights and soccer on Tuesday nights and lacrosse on Thursday nights, it really increases the risk of transmission. It really increases the difficulty of contact tracing. And for those reasons, participants are encouraged to only play one team sport per season.
That's great, Keith. Thank you for that information. And I'd also add that last point that you highlighted would also extend to coaches. We would also ask that coaches and volunteers just remain with one team this for a season, just to minimize that contact tracing and potential of exposure to other cohorts. Okay, so as you are planning and writing down your safety plan, you will need to think about the gathering limits. So each regulation does have gathering limits. They're called gathering limits, but that's the number of participants that you would be allowed to have in an area at one time, provided there's physical distancing. So the number of participants as well as the number of spectators. So as you move through the color coding framework, it does provide the maximum number based on physical distancing measurements that you could have in an indoor space and an outdoor space. So they're the two numbers that you'll have to pay attention to, and your plans will have to be ready to turn on a dime if we move to a different color code. As Keith mentioned earlier, we sometimes get 1 day's notice if we are moving into a color. So you'll have to think about the gathering limits and make plans. Now, the facility that you are attending, if it's an indoor facility, it likely, but you'll want to check with them, but it likely already has plans in place for the number of people that they can comfortably have in the indoor area that can physically distance. So if it's a maximum of 50, if the number is a maximum of 50, the indoor space may not necessarily be able to accommodate 50 because they can only physical distance a number of, say, 22. So their cap will be 22. So this is a very important component of working with the facility that you will be attending to know what their capacity limit will be, so that you can then conduct your registration and your cohorting of teams accordingly. So it is really important to identify, though, that many outdoor spaces are unmonitored and unstaffed spaces. However, if you are conducting an organized event, which a practice is still an organized event, that means that you will be responsible for ensuring that the capacity limits are maintained, even if it is an unmonitored facility. You will need to make sure that, and even if this this outdoor facility, such as a ball diamond, it is adjacent to a park. So sometimes it's very difficult to delineate where is the outdoor space for spectators for that facility, and where is the outdoor space that would just be park or a playground as part of park. But ultimately, you'll need to make sure you're doing your due diligence to stay under those capacity limits, particularly in the typical spectator zones around an outdoor facility. So if you are at a field and there's lots of space to physically distance, but most of your spectators are congregating towards the bleachers, then you will need to put plans in place to make sure those people are moved around the facility so that there is ample opportunity for physical distancing and you can adhere to the capacity limits. We recommend that even for outdoor facilities, you have do ask for one parent or guardian per child to try to stay under the capacity limits.
Perfect. I just wanted to jump in, Janet, with something I forgot to mention on the last slide, but I think it applies to this piece around physical distancing and gathering limits as well. Whether you're playing a sport or an activity in green through red, the regulations are very clear that the sports need to be modified such that there is no contact between the participants. Each zone has a slightly different tweak as to what that looks like, but by and large, that 2 meters that we've been talking about for the last year applies to gameplay as well. And while there aren't specific rules about the number of people that are allowed to be on each team, we know that there are specific rules, and I'll use Hockey Canada as an example in the Ontario Minor Hockey Association that set forth parameters around 10 kids per team throughout the winter. And that was simply to help achieve that physical distance requirements. So while there aren't while there aren't capacity limits on teams per se, you're certainly going to want to talk to your governing body, your sport association, and the municipality that you're using the amenity from to find out what number of athletes can play on one sport at any given time.
Great. I'm glad you added that. So just thinking about physical distancing then, so if you are playing, if you are developing a plan for a sport where it's an individual sport, a triathlon or a running sport, the requirement is that the sport still maintains 2 meters physical distancing. If you are developing a plan for a team sport, Keith is quite right in that you'll want to check with the national or provincial sporting association associated with that sport, as all sports must be modified to not allow physical contact. So even those sports that typically are typical contact sports like football or rugby or hockey, they are not allowed to be contact sports during COVID-19, and they will need to be modified to not allow any physical contact. So your safety plan will need to be incorporate that level of detail. You will also, when the participants are not engaged in sport, you will need to make sure that they maintain 2 meters distance at all times. So by doing that, you will have to put together some protocols to limit the gathering or the crowding that may occur. So come dressed and ready for the event, minimize time in change rooms or dressing rooms. The stagger and start time is very critical, particularly if you're going to a field where there's multiple fields at that site. Then you need to minimize crowding in the parking lot, crowding that would happen in the sidewalks getting to that space. So stagger the start and end times to ensure one team can fully vacate the space and another team can fully enter the area. Again, remember, if you are organizing the event, you will need to have plans in place for your due diligence to manage the capacity limits and the crowds, and that includes the arrival and the departure of that space. So there should be no gathering in the parking lots before or after the event. And again, back to the point I mentioned about the seating, if you are at a facility, an indoor facility, likely, but you'll need to check on this, the facility owner or operator has a system in place for how the spectators will distance in that spectator area. It may mean, for example, with a hockey arena, there's no entry into the small lobby of the hockey arena. The spectators enter at the side and distance along the stands. For an outdoor space, that's maybe not as controlled, you will need to think about where the spectators need to go, and that will need to be communicated to them. You may need to close bleachers or close off typical seating areas if it doesn't allow for people to maintain that 2 meters. It is critical that even with masking and other protection measures, fundamentally the number one we need to maintain is physical distancing. It is one of the best protection methods against COVID-19. Okay, so you are running a sport and you often had an extra bag of equipment in your car to share if kids came up. came without equipment. And unfortunately, in COVID-19, that is really strongly discouraged unless you have a rigorous cleaning and disinfection protocol in place. So you'll want to detail in your safety plan how you're going to be cleaning and disinfecting your items. First and foremost, ask everybody to bring their own equipment. That is the safest method. And limit the use of frequently touched surfaces on the field or court or play surface. If you do have shared equipment, you will need to ensure that you are cleaning and disinfecting after each use, and you will have to use a Health Canada approved product. There is a comprehensive list of disinfectants that are used for COVID-19, so you will have to make sure that your product is on the Health Canada list, and we've linked that to you in the resource page at the back of the presentation. So it's important, though. I know part of sports, the exciting thing is to the snack time and the opportunity to, come off the field and grab the water bottle and use it. But at this time, shared water bottles are not recommended. Everybody should bring their own water bottle that is labeled, and they only use that water bottle. And we are not recommending snacks at this time, shared snacks at this time. So no shared food, shared drink containers or utensils. And you'll want to make sure that if you need to use pennies or vests or jerseys between at games, that they are laundered after every single use using a product that is recommended. So we've come to the part of the presentation that I know you've been wondering about, particularly if you're in an outdoor setting. And this is around face coverings, otherwise known as non-medical masks, and personal protective equipment. So let's start with the face coverings. Again, face coverings are non-medical masks. And if you are in an indoor premise, any person who enters the indoor premise must wear the face covering that covers their mouth, nose, and chin without gaps. There are a limited number of exemptions, which also includes when you are physically active. However, that does not mean that if you are the athlete, you are allowed to come into the indoor area without wearing your face covering. Everyone must wear their face covering up until the point where they begin physical activity. So if you are entering an indoor soccer area, you will need to wear your face covering while you're putting on your shoes. You'll need to wear your face covering up until the point where you start onto the field. So that is really important. It's only in the act of physical activity that an athlete can be exempt. It's important to note, it's strongly important to note that you also highlight this for your coaches and your volunteers and your athletes and your spectators, that physical distancing mask wearing does not replace physical distancing. It is critical that everyone wears their face covering, non-medical mask, and practice physical distancing. It's the layered approach that provides the most protection. For outdoor settings, masks are strongly recommended, particularly in your organized event. You'll want to make sure that everybody keeps their 2 meters physical distance, but if there's a moment in time where somebody's passing somebody on the sidewalk while they're going to the washroom, it's just for better protection if everybody wears a face covering. So we strongly recommend that in your safety plan, you include a requirement for a practice game, anybody attending, that they wear a face covering or non-medical mask. Personal protective equipment. Personal protective equipment is a medical surgical grade mask and eye protection. We've provided a link for you at the end of the presentation to a Health Canada list that describes what personal protective equipment is, and it also provides a list of the approved PPE requirements in Canada. However, it's important for you to know, as you're creating your safety plan, that the regulations do state that if there is a person, a staff member, coach, trainer, providing a service to someone that comes within 2 meters of another person who's not wearing a mask, and they are not separated by an impermeable barrier, then that staff, coach, volunteer will need to wear PPE. So what that means is, If a participant or an athlete is not wearing their mask, because that's the period of time where they're physically active and they are exempt, and a coach must come closer than 2 meters to that person, then that coach must be wearing personal protective equipment. And again, that's a Health Canada approved medical or surgical grade mask and eye protection. There are no exemptions to this requirement.
So now we're at the part of the presentation, I guess, the, oh my goodness, what happens next piece. And we've all experienced this scenario where a child will board the school bus and make their way to school, only to get a phone call later on during the day that the student has become unwell. So for those reasons, it's not unrealistic to expect that the same scenario might happen, that a child might begin, or an adult for that matter, might begin participating in an event, and then throughout the event should start feeling unwell as well. So this next portion really speaks to what to do if. And I'm just going to read through it quite quickly because all of this should be captured in your safety plan. And one of the things too that we might advise is that in your safety plan, whether you're indoors or you're outdoors, whether you're at a privately owned facility or a municipally owned facility, the safety plan is going to have to speak to this scenario, which is why we're not going to tell you exactly what has to happen with the exemption, obviously, of these high-level pieces that you want to let the people know that somebody has become unwell. That might trigger that the facility would then do a little bit of extra cleaning around the area where the person was. We want the person who has become unwell to be isolated, that they're not going to be, lining the bench or in the dugout or what have you. And that they'll be separated from others. If they're able and not having a difficult time breathing, obviously we want to put on that mask for source control so they're not spreading those COVID droplets. Obviously, this person should not participate in the activity. And how that person gets home, again, we would leave to you, whether they leave with the person that drove them, which is the best case scenario. In the instance that they were dropped off, we would want that person to call home and arrange for transport with somebody from their household, avoiding public transit and ride shares and public taxis and those types of things. Have them get home, and when they do get home, go back through those screening tools. The screening tools really go through all of the symptoms, and when those symptoms are identified, specific instructions will come out for that staff or volunteer or the participant, whichever link they click on, telling them what they should do next. And basically what will happen is that person might be referred to testing, in which case we'll talk about that on the next slide. That person might be referred to call telehealth to talk to a public health nurse or a registered nurse on the phone. In any event, we really want you to seek medical attention as required and follow up with whatever the outcomes are of those screening tools. We get this one quite a lot, whether it's an apartment building or a school or other settings where there might be multiple people that are in the same shared space. So what happens if there is a positive case associated with your club or team? The good news is, and I know it's unnerving, but in the event that one of your athletes is ill and public health does not call you, that means the safety plan has worked. That means the protocols were followed. That means that the public health staff that are investigating the COVID incidents have determined that there was not a risk to your club, your team, your sport, your event, your activity, and so on and so forth. And what's really going to be happening in the background is that public health staff will be supporting that individual and their family or their household with getting better and advising them on the next steps. So if through that investigation where somebody is test positive for COVID, a public health staff will begin case contact management. And that's basically an interview process where they'll figure out who they were around, what activities they were participating in, and a risk assessment will be done. So again, if through that risk assessment and that interview process, your club or your team or your organization is not identified, that's good news. We know it's unnerving, but it means that everything is working and that the person is getting the support that they need. The next steps from there will really be making sure that, if it is identified that, the participant did share a water bottle or there were communal snacks or there was a breakdown in the safety plan, at that point, public health staff would then be in touch with the club, the team, the sport, the organization, to do that risk assessment again and figure out who it is in broad strokes from the team that needs to be contacted, which is why going back to those initial screening and attestation forms, we'll need to know who was at the activity on Tuesday night or Thursday afternoon or whatever the case may be. And that's why we ask that you keep those forms for at least 30 days in the event that we do need to follow up with other people that are associated with the activity. Essentially, what will happen from this point on is that there will be very regular, near daily contact with the person who tested positive and public health staff, advising them on what the next steps are. So that person will not be permitted to go back to play that sport or activity until they've received clearance from Peterborough Public Health. And that will come over the course of 10 to 14 days, depending on how quickly they recover from COVID. But all of that will be handled in the background with public health staff and the patient or the client that has tested positive. One of the things we really want to do is really protect the privacy, obviously, and the public or the personal health information of the people that are associated with the activity or the event, and really leave it to public health to take the lead on this contact tracing piece. In the event that we need your help to share the message or get more information, we will advise on that, but please do not attempt to initiate contact tracing or notification of other participants until you've been directed to do so by public health. Misinformation and rumors can start, and public or private health information can be jeopardized. So really just let public health take the lead on that. You'll be notified when you need to be notified, and the person will be cleared to return when it's safe to do so. The caveat being that if you learn of 2 or more participants from your team that have been diagnosed with COVID within that 2-week period, that's when you should be proactive, reach out to public health, let us know that you've had 2 athletes or participants within that 2-week time period come down with COVID. Because what that tells our case and contact managers is that there might be something happening within the sport or the organization. This isn't anything to be afraid about, honest. We're just trying to make sure that contact management can happen so that other players that might be impacted by this will receive the same guidance from public health staff that they'll need to stop the spread within the community. So the big ones there, the takeaway from this one is that if you're not contacted by public health, that's good news. It means your safety plan has been working. Public health will take the lead on making sure that the person receives the support that they need, and then we'll subsequently clear them when it's safe for them to do so.
Great. Now that concludes the content portion of our presentation, but I just thought I'd pause and review because we have gone through a lot. So first and foremost, step 1, consult with your provincial or national sporting organization for your sport to determine their return to play guidance. Again, they will likely have detailed steps on how your sport needs to be modified to meet COVID-19. Secondly, you need to review the Ontario COVID-19 response framework, the associated regulations, as well as the color code assigned to Peterborough Public Health. But it's very important to spend your time digesting the entire framework because, again, we can move into any color at any point in time. Consult the protocols in place at the facility you want to use. Again, it's like a puzzle piece. Their safety plan and your safety plan should cover off all the components in the regulation to make sport and recreation, gameplay and practices and events safe. Step 4, develop your safety plan with all the components of the information that you have learned, as well as what you are hoping to take shape for this year. And then step 5, communicate out your safety plan to your participants, coaches, parents, and volunteers. Ideally, you are communicating your return to play safety plan at the same time as registration so that people can make a decision about whether or not they want to participate in that activity. They need to be aware that because of the close contact nature of sports, that potentially the high risk activity is something that they want to sit out for this season. Now, you may have questions. We may have skipped over something, or you have thought about the nuance in relation to your sport or your activity. So you are more than welcome to follow up with Peterborough Public Health at any time. We do not need to approve your safety plan. Ultimately, your safety plan is something that needs to be sent to your facility, and you work with your facility on making sure you cover off together the requirements of the regulation. But you are more than welcome to consult with us to get support with your safety plan. If you have questions, you can dial the 705-743-1000 number and follow the prompts to reach our COVID-19 hotline, or you can always send us an email at any point in time. And as promised, I wanted to highlight that we did discuss a number of resources that you should be cognizant of and reviewing as part of your safety plan development. And so here on the screen, you can see the link to get to the response framework and the links to get to each of the regulation. We've also provided that the province has a safety plan template. They also have a safety plan checklist that will walk you through some of their generic questions. You can see the guidance for sport and rec facilities and all the components that they have to cover off. There are the links to the active screening tools. The active screening tools have PDF sheets that you can print off, but that means you also have to check back that the PDF sheets do not change. And there's also online screening tools that the province provides at this link. We've also provided the Health Canada list of approved disinfectants and sanitizers, as well as the Health Canada list that details PPE and also the approved list for PPE. That's the end of our presentation, and we wanted to say thank you very much for watching. And if you have any questions, don't hesitate to follow up. Best of luck with your season.
Thanks, everybody.